Hello and good afternoon, good evening if it applies. Welcome to Open Classroom. I'm Janet Gillow. I'm the Director of Professional Development for the Brown School, Washington University in St. Louis. Thank you for being with us for today's program. For our audience joining us on Zoom, throughout this program you are muted. We can't see or hear you, but we love to hear from you. And thank you for those of you who've already checked in by the chat. You can send comments into the panel or anything that you would like to share with the whole room. But as the program goes, we really do welcome your questions and comments. Folks joining us on YouTube, we are very happy to have you with us. And I do want to make you aware that we don't have a way of directly fielding your questions or comments at this time. So before we get started with the program for today, I just want to let you know a little bit what's coming up on Open Classroom. We're going to be taking a break next week. Most of the staff that's involved in supporting this are going to get a little bit of downtime, whether that's spring break, Easter, Passover. It's going to be nice for us to step away, and I hope that as any of those events or holidays apply to you and your family, you enjoy them. But we will be back in April on Tuesday, April the 6th. Janelle Gibson is going to be with us to talk about trauma-informed organizations and management techniques. And then we'll be back in Thursday of that week, that's April the 8th. Megan Keys is going to be talking to us about compassion fatigue and burnout during COVID-19, risks and strategies for resilience. So just a little bit of a sample of what's to come, always good programming headed your way. One of the things that's been cool for me about Open Classroom is it's given me a chance to collaborate with a wide variety of people on campus and off. And today we have a new co-host for me, a first-time co-host. So please join me in welcoming Jen Rose Fitzgerald, who's a program coordinator at Washington University Social Policy Institute, helping to moderate Q&A and just otherwise support today's program. Welcome, Jen Rose.
Thank you so much, Janet. I am happy to be here. As Janet said, I'm Jen Rose Fitzgerald. I use she, her pronouns. I'm the program coordinator for the Training and Education Initiatives at the Social Policy Institute. And I am delighted to introduce our esteemed speaker today, Dr. Sarah Moreland Russell. I've had the pleasure of getting to know Sarah through the Graduate Policy Scholars Program, where she's a faculty advisor. And this is a program that is an initiative of the Clark Fox Policy Institute in partnership with the Social Policy Institute, and it gives graduate students an opportunity to supplement their formal curriculum with additional trainings and engagement with policymakers and other change agents beyond the classroom. So Dr. Moreland Russell is a great asset to this program. In her role as advisor to the Clark Fox Policy Institute, Moreland Russell develops policy curricula, teaches several policy-related courses, and continues an active research portfolio focused on public health policy, dissemination, and implementation, hence the topic for today. She also provides trainings to academic stakeholders and other practitioners on how to engage in the policy process, translate research findings into policy recommendations, and design research to answer important policy problems. So here to share with us policy theory and public health, please welcome Dr. Sarah Moreland Russell.
Thank you, Jen Rose. That was a wonderful introduction, and I really appreciate that. Just a few things before I get started. So I know the idea of a lecture on theory and policy analysis may seem a little bit dry, but part of the reason that this is one of my favorite lectures to provide to students is that often in public health and in social policy, we haven't looked at some of those traditional political science theories because we're not traditionally trained in those. And so I really look forward into not only providing, some information maybe that those on the call who were traditionally trained in public health or social work may not have learned, but also apply those to some true applications that have already happened in the policy realm. And some of those applications I draw directly from some time in the Senate that I spent working as a policy analyst. So I'm hoping that this information is helpful to all of those working on policy, whether it be, on the technical aspect of analysis or really understanding sort of how policy and policy topics enter and exit various political agendas. So I'll go ahead and get started. I will say I'm going to mute my video just because my bandwidth is better that way. I will be back on for Q&A, but as I give the presentation, I'm going to mute my video. So I'll see you all in a little bit and I'll get started. So like I said, you know, I'm going to talk today about policy theory and policy analysis. Historically, public health was formed out of studying population or community-based issues, and laws were developed accordingly. Some of the first laws addressed really were around that sort of population-based policy around safe drinking water, sanitation, immunization, and were really foundations of public health intervention. It then began, public health sort of took a transition and began to focus more on individual behavior and use more individual level and behavioral change interventions that focused less at the population level. But now, you know, we promote policy as in public health as the primary evidence-based intervention. Instead of thinking about individual behavior, we think about the context in which that behavior is set. Whether it's, you know, within the home, the community, at the system level, that might be driving behavior. So today, policy is inherently part of our public health interventions. Just looking at across these broad guidelines that I have on the screen, and some of these are even old now, you can deduce that policy has been used to support a number of public health endeavors. And just so that you all know, you know, historically, my research has really focused more on tobacco control, obesity prevention, and childhood well-being. So I'll draw from some of those, but have also brought some other examples from other public health policy interventions. So because policy strategies are the primary evidence-based intervention, I feel we must design research and evaluation that helps us understand why policies don't work or do, the best approaches to formulating public health policy, and what pieces need to be evaluated to determine the strength and opportunity for replication. That said, policy is messy, and many people in public health are not trained in how best to engage in the policy process. It is definitely not a clear-cut and clean process. It involves a lot of ingredients, a lot of different hands, some things you don't want added, and some things you do. And I bring up this, this quote from Otto von Bismarck: "If you like laws and sausages, you should never watch either one of them being made." Some people enjoy the sausage making process, others don't. But regardless, you know, even though it is messy, it can produce sort of wholesome results and important results to address some of the the policy problems that we have. So how can we make sense of this mess and learn from it? How can we most effectively engage in this process? That is really what I want to talk to you about today, to provide you some information to do that. So this is the agenda for today. First, I'm going to talk about how theory drawn from political science rather than public health specifically can be used to study public health or prevention policy. And it also applies, I think, to social work issues and social policy also. Political theorists have developed several theories that help us break down the process and understand the factors that make policy good and effective. I'm also going to present specific examples of the use of these theories in public health so that you have a direct application of what it is that I'm talking about. So why do we use theory in public health? Theories can be useful in public health research and practice for a number of reasons. They can be used to develop and test hypotheses, identify factors that influence certain behaviors, determine program or policy activities to address specific health behaviors, implement programs or policies, and measure and evaluate program or policy effectiveness. So some of the theories that look more at the population base that we use in public health and social work and social policy are those that are sort of presented here. On the left is Frieden's triangle, where there's a triangle sort of interventions and the breadth of their effectiveness, and the more impact is more at that bottom level, right? That at that socio-economic factors and more change at the population base. And similarly, the socio-ecological model, which is represented on the right-hand side, it really shows an individual nested within various contexts, whether it be interpersonal, organizational, community, and then at the public policy level. And we can see, just by applying that model, that if you introduce a public policy intervention, it really can affect people nested within all of those contexts presented in that model. And so I bring these are, definitely useful models to use in public health, and definitely more useful than some of the traditional like trans theoretical behavior of change model and health belief model, but really, doesn't just provide sort of those contexts, doesn't really allow you to understand how the policy process might engage or impact each one of these contexts. And so the theories that I really want to present today are more based in the political science realm. So there are many theories in political science, obviously. I'm going to cover the ones today that have been applied to the study of public health and social policy specifically. These theories in particular have been applied to a range of topics from healthcare to tobacco control. The theories highlighted here and in the next section not only provide frameworks for understanding policy progression and institutionalization, but also provide insight for understanding the setting and context in which the various actors interact to form policy, as we will see next. So the first one that I'm going to start with is the stages heuristic. It offers a really linear and discrete way to understand the complexity of the policy process. However, those who work in policy or that have any sort of experience in working in the policy process know that this is not very representative of policy process because it's not linear and it is often very complex. Until about the 1980s, the stages heuristic was the most influential framework for understanding the policy process. But really today I only bring it up because it did lay that groundwork or basis for all of the other theories that I'm going to discuss today. It is, it represents policy process as clean and neat, but don't let that fool you. Policy is really rarely described using either one of these terms. So really the next, I wanted to bring stages heuristic to your attention because it did outline, the components of the policy process, right? So problem identification, agenda setting, formulation, adoption, implementation, and evaluation are very important pieces of the policy process. But there are various processes and people and ideas sort of that go on within each of these boxes. And often, policy is formulated very quickly, sometimes without even setting a political agenda, or it is formulated without understanding the true problem. And so while it does, sort of provide a foundation and the components of the policy process, we really use these theories that I'm going to describe next to understand some of the underlying content within each of these sort of buckets. So the first one that I'm going to share with you today is the agenda setting theory. It really explains how one issue gains public attention and competes for prioritization on the policy agenda. Several factors play a role in the agenda setting process, including gatekeepers. And these gatekeepers can really be media, leadership, advocates, organizations, policy staff, and each of those you need to keep in mind have unique cultures and values. And the other sort of factors that play a role in agenda setting are focusing events, interpersonal communications, and real world indicators. It is important to note that within the agenda setting process, people are not passive consumers of information, but rather active seekers and users of information. And so that's a really important piece of the agenda setting process. And here I just provide a visual of how the framework plays out in the various actors that are involved. And you can see on the left-hand side that the gatekeepers and influential media really have an impact on the media agenda, the public agenda, and the policy agenda. And all of those sort of intertwine sort of, and you know, there's bi-directional sort of impact as you set agenda across the various media, public, and policy platforms. So just to give example, so I don't know how many of you followed this. This is a picture of the late John Lewis, who was a phenomenal representative from Georgia, and really a leader for the Democratic Party, and a leader across several sort of policy platforms. But in 2016, he did something that was pretty unprecedented at the time. He started a House sit-in, which was organized by him and House Democrats. The really sort of unprecedented thing about this is that he did this on the House floor. You know, House floor sit-ins are not uncommon, but coverage of House floor sit-ins and the use of cell phones and media coverage on the House chamber is completely restricted. But however, you know, the Democrats and those involved in the House sit-in really, you know, brought the issue to America by really, you know, using Twitter, using Facebook, doing things live in the House chamber, and really set the not only media agenda, but the public and brought the public in and the policy agenda around this. I was actually in the Senate at the time, and senators are rarely invited to the House floor, but they were, and senators actually also joined in the House sit-in. Social media went crazy. And so, yes, we set the agenda around gun control, but unfortunately at the time, we didn't set policy around that. And the next theory I sort of present will explain why. And, you know, I think even with Biden's gun control agenda, political agenda, gun control continues to move forward, I think, in the policy process incrementally, but you know, often we set the agenda around gun control, and policy is rarely made. But this was a good example of how something can gain attention on the media, public, and policy agenda all at once. Another really more recent and really good example is Black Lives Matter. You know, it became a hashtag, it became a brand. There were, you know, a lot of public presence and involvement with activists, and really, you know, the media followed this, the public followed it, and really there was a sort of a coalition around Black Lives Matter, and there still is. And it really resulted in a lot of policy. So it not only set the media agenda and the public agenda, but also the policy agenda, and resulted in a lot of policy, including the Breathe Act, which sort of formulated policy that invests in a new vision of public safety that is less brutal and discriminating. And so, you know, Black Lives Matter is a brand that continues today, and something that we continue to consider, and hopefully remains on the political agenda to address the issues outlined too. So the next theory that I want to bring up is Kingdon's multiple streams. Kingdon created the multiple streams framework to better understand the structures and patterns of the policy process with 3 streams: the problem stream, the policy stream, and the politics stream. And I'll go into that in just a minute. One of the main points is the window of opportunity. Those people who have studied public health, this is probably the most broadly applied political science theory in public health. but the window of opportunity allows for the separate streams to sort of become coupled and come together. So we'll talk about that in a minute too. So a natural question which emerges in any consideration of the policy process is, what exactly is the problem to be addressed? And that's exactly what the problem stream does. So it identifies the problem and recognizes the problem. The policy stream regards proposals for policy change. These could be new proposals. These could be alternatives to current policy. Really, in the federal government, the policy stream, often we hear, there's thousands of policies every day sort of submitted to the federal to the congress.gov or to the policy platform, but rarely are some of these considered, but they're all policy proposals, whether they're new or alternative. And then the politics stream is composed of political issues, election results, changes of administration, interest group campaigns, or changes in public opinion. So anything you can really sort of define as politics is in that stream. And so how does policy change occur? The streams which normally operate independently are coupled by policy entrepreneurs at critical points in time, providing the opportunity for policy change. So if we really think back in the instance of 9/11, the focusing event made the problem on sort of poor security in the airlines relevant. Political pressure to act immediately set policy developers to the drawing board and resulted in stronger airline security guidelines and the creation of the TSA. So, other instances are, in tobacco control, the Surgeon General's report in 1968 at the time when there was a first release of data that tobacco use was bad. That Surgeon General report really forced the problem, policy, and politics stream to come together, and there was it created a window of opportunity for taxation on tobacco, creation of stronger laws and restrictions around tobacco use, and things like that, and also advertising at that time. So those are just some old examples. Now I'll provide some more recent. This again is from 2016 when I was in the Senate. This was the passage of the Comprehensive Addiction and Recovery Act. So in 2015 and in 2016, media had been setting the agenda and formulating the problem of opioid use and related mortality in states across the United States. So it was really a national issue. I just brought up some pictures of a number of different people here from New York. There was lots of stories on opioid use and resulting mortality and morbidity. And so really at the time, there were a number of representatives and senators coming together to propose a number of policy alternatives. So we knew the problem. We had policy alternatives. And so it really started to align with the politics when the problem showed that it was across, several areas, whether it was a Democratic or Republican state. It really was a major crisis in the United States at the time. And so they passed the bipartisan bill known as the Comprehensive Addiction and Recovery Act. I just wanted to give an example of that. A more recent obvious example of this, I'm sure all of you were thinking of it while I was presenting, is the CARES Act and also the subsequent American Rescue Plan. This, obviously the focusing event here was really the window of opportunity, or created the window of opportunity for the passage of policy. The focusing event obviously was the COVID-19 pandemic and resulting sort of financial downturn. Congress had to act immediately and come together, whether they agreed on all of the components or not, to pass the law. And really, you know, this is unprecedented in regards to the amount of money for Congress to devote to a certain bill. Or both bills actually, and really covered a broad range of issues, from, you know, unemployment to corporate packages, to even now, you know, expanded vaccines and contact tracing. So, you know, this definitely was a very good example of how Kingdon's model can be applied to the passage of policy here. The next political theory that I'll bring is the institutional analysis and development. I'll call it IAD, just so that I don't have a tongue twister here, but it seeks to explain the influence of institutions on policy outcomes. IAD is used to understand the formal and informal institutions whose established rules influence the behavior of rational individuals. And rationality can be defined in a number of ways. And so what, you know, us as public health or social work or social policy might define as rational may not be to people in other institutions. Institutional rules can vary from mutually shared norms to explicitly enforced guidelines. So, you know, if we think about developing smoke-free laws in bars and restaurants compared to hospitals or office settings, if you think about those as different institutions, you're going to think about different cultural norms, obviously, in bars and restaurants compared to hospitals, where, you know, hospitals are more of a culture of health and wellness, hopefully, and bars and restaurants are more about, you know, sort of individual practice and sort of enjoyment. So here, you know, I think this table helps people put different institutions in different boxes and understand sort of how you apply this theory. So on the left-hand side, or down the left-hand side, there's the extent of rational choice from low to high. And then on the bottom axis, the extent of institutionalism from low to high. And so really, if you think about, you know, just giving some examples of where some institutions might fall, might be, you know, a public health administration or office setting where the extent of rational choice is high, and the extent of institutionalism is likely high because of, you know, bureaucratic processes or protocols, practices, and objectives. On the other end of that, bars may be like in quadrant 2, where the extent of rational choice as we define it, you know, in regards to health, might be more low as far as rational choice goes. But decision making is high and is shaped on peer influences. So I speak more of that from the tobacco control sort of experience, and that really people didn't, you know, people go to bars and restaurants sometimes not only to eat, but to smoke. And, you know, they support each other as sort of a peer coalition, and they're more shaped, their heuristics and biases are more shaped in that way. So that just gives you a few examples, and you may disagree or agree here, but that's one way of thinking through the institutional analysis and development framework. Some examples of application more recently. So I don't know how many of you recognize this picture, but it's a picture of Sturgis. You know, the Harley community, I think, can be seen as sort of an institution. And I brought this up, I think this was in June of 2020, when, you know, there was sort of the height of the COVID-19 pandemic. They decided to go ahead and move forward with Sturgis. The leaders, you know, of this main event did not want to wear masks, and really wanted to focus on individual rights here. It ultimately resulted in a super spreader event, but that just goes to show that, you know, as an institution implementing something like a mask mandate or, you know, other protocols like social distancing, it was going to be much harder in this institution and a lot less supported by all of the people within this sort of Harley community as an institution. Another example is the federal government as an institution. And I want you all to sort of think about how changes in administration or leadership can result in a shift of how they formulate policy, the policies that they promote, and are sort of forward facing or promoting a brand or policy. So in the case of President Trump, you know, even though people, executives like in the executive administration like Fauci or the CDC or the NIH were sort of promoting mask wearing and social distancing and sort of greater protection and restriction related to COVID-19 to prevent the spread. You know, Trump being the leader of this institution really quieted those people within the institution who did not agree with him. He rarely wore a mask, I shouldn't say never, but often, you know, even when he was in the media or promoting events or going even to hospitals, wouldn't wear a mask. There were also super spreader events at the White House during Supreme Court confirmations. He, you know, regardless of catching the virus, he still was, you know, out in the public in a van, but with Secret Service, and so didn't really follow even the quarantine guidelines. And so he as an institution sort of set the stage and of not only his administration, but, you know, across several public opinions too. So I believe this is the last theory I'll cover, and then I'll take questions. The diffusion of innovations theory is a theory that seeks to explain how, why, and at what rate new ideas and technology spread through cultures. There are four main elements of the diffusion of innovation: attributes of the innovation that affect the rate of adoption, communication channels, time, and the social system. In addition to the four elements that are part of the diffusion process, Rogers, who led the development of the diffusion of innovation, outlines 5 main policy attributes that affect the rate of diffusion. Those attributes that positively affect the rate of adoption include relative advantage, or how the policy is advantageous over the current option or other policy alternatives, compatibility, whether it's in line with the norms, ideologies, and needs of the community, trialability, whether or not the policy can be tried and seen as successful, and observability. So not only tried and been successful, but has also been seen to be successful. The only thing that negatively affects the rate of adoption, according to diffusion of innovations, is complexity. So is the policy complex and not easy to implement? So one example, and this is actually from my own dissertation, so this dates me a little bit, but I tracked the diffusion of smoke-free laws across the Kansas City area. At the time in April 2006, there was a proposal sort of on the board in the greater Kansas City area that proposed that if 20% of the greater Kansas City area municipalities adopted smoke-free laws, then the entire area had to then adopt a sort of community level policy for smoke-free. And in 2006, you can sort of see the documented, just the little municipality with the FW, that's Fairway, Kansas, sorry, Fairway, who at the time, the political champion was a doctor and really led this effort to really get more involved. And then, you know, you can start to see various municipalities over the course of time start to to adopt smoke-free laws, and most of this was, neighboring communities being able to see that it didn't hurt businesses and that the policy wasn't complex. And by March 2008, across the state line, so that line sort of down the middle is between Kansas and Missouri here, a majority of the area had gone smoke-free, and by March 2011, most of the entire area did. And so that's one, visual graphic, I think, of the diffusion of innovation. The other more recent sort of example is, this is a graphic actually from the New York Times, and this is documenting mask usage in the United States as of July 2020. And I think you can kind of see, the areas in which the highest mask usage is also areas in which COVID-19 was more of an event and was causing more cases at the time. And also the more sort of compatible with norms in these states, less, I think at the time, Trump support states are wearing masks more than those sort of states that were more aligned with Republican or Trump sort of ideology. And so this was just another example. I wish that I had a diffusion map showing it over time, but this is the best I could find right now. So that is all I have, and I will now take questions. Stop sharing.
Sarah, thank you for that. So much information covered very quickly, and lots to get to. So definitely want to encourage members of the audience to take this opportunity to put their questions in chat. As we're speaking, it's March 25th, and in the last 10 days, there have been 2 really horrific mass shooting events here in the U.S. So as I was reflecting on sort of streams and windows of opportunity, and I'm speaking as a personal point of view and not trying to put my politics or point of view on anybody else. It had me wondering whether the current climate might provide a window of opportunity for action around some gun control measures. I'm just curious from your expertise, for someone who is wondering about that, what do you see in this moment, and do you feel like perhaps it is a window of opportunity, or are there critical pieces we're missing?
Yeah, so unfortunately, mass shootings have happened for a number of years, on a number of occasions, and over sometimes. And you would think, like, how do we not have, more restrictive policy or gun control policy at this point? And, I think I'm hopeful actually that the Biden administration has sort of proposed a new set of gun control policies. So I think aligning, the administration with potential sort of policy alternatives or options in Congress is something that's very, very key. But I also, the problem stream, unfortunately, because of policy, we were really unable to collect a lot of data around gun use, gun control for a number of years. Sort of restriction in policy for doing that has just opened up. So I think we're able to define the problem. We know from a public perspective some of the major issues, but I think from a data standpoint, being able to do more research in this area and really defining the problem will allow, sort of those streams to compress, because we've had the focusing events, we've had sort of the opportunity for those windows to open and for policy to progress, but have not been that sort of successful in moving forward. And obviously, there's players involved and gatekeepers, especially when it comes to the gun lobby and people for gun rights and things like that in gun ownership. And so, there's definitely different players involved also. Good question though, Janet, thank you.
So we have some questions in the chat. Michelle is asking, how does social media play a role in the diffusion of innovations theory? Thank you for that great question, Michelle.
Yeah, so I think it actually provides a much faster platform and diffusion of information. You know, before, you know, to see something or try something out, we sort of had to wait, I think, a greater amount of time. And now you can see it on Facebook or Twitter, or, you know, as it is happening live, or YouTube. So the rate of adoption, I think, can happen more quickly. And so social media sort of provides that platform for that to do that.
So we have a question from Angelica. She's, I think, just curious a little bit more about your background, and I'm going to expand on her question a little bit. She was curious about what years you were a Senate staffer and what committees you were involved in. And I'll go ahead and embellish the question to say, I'm always curious. I mean, you led with, it's much more complicated than this linear process. You know, don't kid yourself. So I would say, in sharing a bit about your experience, if there's a myth that you think is commonly held that just does not generate, you know, does not resonate with your experience, anything you want to share about that time and that career experience you had.
Yeah, so just a little on my background first. So I actually have my master's in public health, so really started in the public health realm. I decided to pursue a specific degree in political science because I wanted a more comprehensive view of political science, I think, because at the time I did start to see that public health was really using policy approaches. And so instead of getting like a doctorate in public health, I got one in political science, which really sort of opened up my eyes to a number of things. But really, you know, I don't think I learned the true sort of complexity of the policy process until I went to the Senate. And I would encourage anyone that is interested in policy or policy making or contributing toward the policy process to really have an experience where you're working with people who are making policy decisions, because it's very informative and provides a lot of perspective on sort of everything that comes to play. So I worked in Senator Gillibrand's office. She is a senator from New York, recent presidential bid too, but she still is a senator there. I worked on actually food policy. The school lunch program, SNAP, anything related to that. But then I also worked on anything related to health and education, and was there for about a year, and really just took a sabbatical out of time in my academic life. The most, I think, eye-opening thing that people may not, you know, realize is that there's a lot of great and smart and wonderful people who work in Congress and that are just working really, really hard. There are a lot of really great relationships across the aisle, you know, even though we don't see it. A lot of times I think we see a very polarized, and that's not to say that there isn't polarization in Congress, but a lot of people are really trying to work together. I think a lot of people that work in Congress, at least that I interacted with, were really committed to their work and really wanted to see good policy change. And so, you know, we may not always see that sort of aspect of Congress on the media or presented elsewhere, but you know, it's really important work, and there's a lot of really important work going on every day that we don't even know as constituents that is actually going on. And so, you know, being part of that process, following, you know, issues that you're interested in outside of sort of what the media coverage is really important, and I think can inform a lot of people of what's going on, you know, on a regular basis. So I hope I answered all those pieces of that question, Janet.
So another question coming in from the chat from Douglas, and this is a great question too. Many of us have had this question at one point or another. How would you recommend influencing policy when the politics are not in your favor? And it says, in my case, I'm speaking from Florida, where not all of my agency's policy priorities align with the state's policy priorities.
Yes. Yeah, that's a great question, and sometimes extremely challenging. I will admit that one of the reasons that I chose Gillibrand's office is because she actually will not sponsor a bill unless it has a bipartisan component or co-sponsor. So working for her office, you always had to see things from the other side. You always had to discuss with your sort of Republican counterparts the main sort of sticking points, what might make them, buy into a bill, sort of aspects that they might want to contribute. And sorry, I worked in a Democratic office, so I say they as Republicans because I'm a Democrat too. So just caveat there. Often understanding the other side and presenting aspects that address their issues or understand their issues with your current sort of policy perspective, I think is really, really important. And sort of invaluable in the process, right? Because even as you're advocating for a bill or a piece of policy, or even in moving things forward, you want to understand that other side, right? Because you also don't want it to result in an unintended consequence or something you didn't consider that the other side did. And so I think, trying as best as you can to work with your colleagues that aren't necessarily aligned with your political perspective or your political agenda, I think is really important.
Great. So our friend Gary is asking a question. No pressure, right?
Oh no.
But if you are new to this, if there is a cause or an issue that you would like to impact, what would you recommend as first steps to either building the political capital or the confidence to to get in the game and start advocating for a point of view?
Yeah. So 100, and this was going to be in my closing remarks. So thanks, Gary. I appreciate this actually. Get involved, in whatever way that you can. I teach a class actually where we teach students how to go to US Congress and promote a piece of legislation or educate themselves around a piece of legislation and advocate for that piece of legislation. So they actually have to go to, Congress and educate someone around a particular issue. If there is a problem that they've identified in their schoolwork that needs legislation or that needs, to be addressed, they sort of educate people on that problem and advocate for that. So, getting in front of your representative, making them know you and know that you're passionate about an issue and maybe even an expert on that issue, I think is really, really important. And Gary, it's funny that is asking that question because he's done a very, very great job at doing all of this. But that would be, sort of my number one, whether you're an academic, whether you're an organization, whether you're, wherever you're from, go to your representative and sort of make your issue known and offer your guidance and expertise in any way, because that's what staffers need, on a regular basis in Congress specifically, and I'm sure at the state level too. I'm just speaking from a federal level. They are addressing any number of policy problems and trying to come up with solutions, and they have limited data sometimes. And so you being a source of information and bringing them information and being passionate about an issue and following up and sort of maintaining a relationship and building that relationship, I think is really the best thing and most important thing first to do.
Great, and we've got a lot of questions coming in here, so I'm wading through them. One question asks, and it's sort of a follow-up to two questions ago, I think, in a way. According to your study, should policy be defined at the municipal level or at the state level? What is the more efficient route to get action on early and primary education? So I guess the question specifically on early and primary education, or even generally, how do you think about these different levels?
Yeah, and diffusion of innovation, I think is a really good and useful theory to sort of study that, because so it sort of depends, I want to say, on the policy issue. So in the instance of smoke-free laws, it really was, grassroots effort across, several sort of municipalities, tiny municipalities across the United States, right? And started in like the 1990s in California. And Americans for Non-Smokers' Rights like started and started developing this coalition around people that were interested in policy development, and very grassroots effort. But then it spread from local municipalities to statewide efforts, and that very much the approach was better at the local municipality level, because there were just too many I think opposition, bigger players at the state and the federal level sort of opposing their efforts. And so I think understanding who the opposition is in whatever policy platform you're trying to move forward, and sort of where their presence is and where you're going to meet the greatest sort of challenge is really, really important. And also knowing, if you can start at the municipality level, if you have, a municipality where you have a really great champion, you have a local level community that supports the efforts, start there and build that bandwidth and move it forward, because policy is definitely something that can be, developed incrementally and move forward in that way. So, if policy is gaining traction at the state level and you can develop it at the state level, then go for it there. But if not, then maybe go to a lower level platform and try there. That would be my sort of advice. I don't know when it comes specifically to primary education, because I'm not in that area, but just in thinking through the diffusion of innovations and all of those sort of attributes, think through the policy with those.
Great. Well, we were just invoking Gary's name, and for those of you on the call, that's Gary Parker, our Associate Dean for External Affairs and the inaugural director of the Clark Fox Policy Institute. As Sarah was saying, he's very expert in these things and actually is teaching a summer institute course. So I'm going to drop a link in the chat. We'll be spending a week together online. If you are interested in, honing some skills in this area and dedicating some time, that might be an opportunity the Brown School has to offer for you. For our next question, I'm going to read this because it's very thoughtful, and I wanted to give you a chance to respond to Michael. He's saying, if the answers lie more in systems and less in individuals, what would you consider the most salient of the policy platforms? Media, policymakers, interest groups. For example, instead of implementing more restrictive gun laws, maybe it would be more effective to address the systems that have grown people who are inclined to shoot people. Does that mean we need to focus on public opinion and education, or something else? Weighty, but I wanted you to have a chance to respond to it.
Great question and very thoughtful. And I am a systems level person, so policy approaches to me, whether they're within the community, at the state, or at the federal level, are going to be more impactful because they impact more people, right? But you're absolutely sort of documenting, I think, and highlighting some of the main issues, especially as it relates to gun control, in that there's lack of education on what restrictions are actually being brought up, the systems in which sort of enforce like background checks or gun sales, and other pieces. And so public policy at the federal level is often developed very comprehensively and will actually address several of those components. So, in the case of like the Comprehensive Addiction Recovery Act, which I brought up, it wasn't just, okay, we're going to set restrictions around opioid prescribing so that there's less usage. There was also a whole huge section on mental health supports and the mental health support system, the, sort of education to doctors and pharmacists, and then also family supports for those who had possibly an addict in their family, and then additional supports for those that were addicted to opioid, and sort of the systems to support them too. And so policy at its finest sort of breaks that problem down into all of the various parts of the system that could ultimately address the problem, right? Because you don't want to just address one piece of the problem. You want to address, the multiple sort of complexities within that. And so, good, true policy is going to address those various, I think, components of that system. So hopefully, I don't know if I answered your question, but, if gun control laws right now, those proposed might focus on one issue, but when ultimately, like if they propose a true gun control package, it would be a bigger piece of legislation that had various, previously proposed policy components in that big package. So, I think that a lot of federal government bills are implemented in that way.
So I know we're near the end of our time, but there's a question here from Tyler who said, I really enjoyed your presentation, and is asking about, there are a lot of theories in political science and public health, and a lot of time not a shared language across disciplines to talk about the same issues. And you kind of mentioned that at the very beginning of your talk. In your experience, how has the lack of agreement in theoretical perspectives influenced the adoption of policy change?
Yeah, so, and, I think across disciplines, we all speak different languages, right? But ultimately, we're sometimes focused on the same problem, right? We're just speaking different languages about the same problem. I actually teach this class or teach this lecture in an epidemiology class where they're trying to understand how data plays into the policy process, right? So, I come in and tell them how data can play a role in the policy process. We all sort of have, I think, various expertise and components that we're more interested in the policy process. Just because you're an epidemiologist or you're an interventionist in the public health speak, it doesn't mean that you aren't playing a role in the policy process already. You just may not know it. And so I think becoming more well versed and understanding sort of the policy process and where your expertise can really help in the implementation and evaluation and sort of development of policy is really, really important. And so I think it's Tyler Frank, probably, I'm not sure, but I'm a public health person with a love for policy. And I think the more that we teach across these disciplines, it's the more that language will start to sort of integrate.
So we are to our last question. I think this audience could keep us going a while longer, but something that came up a couple times in your comments, but I don't think in the slides, is branding. How an issue is defined and named and understood. And I guess just would love to ask you to comment on the importance of what words we use to describe and frame an issue, and how do you influence what the thing that you're trying to change is called.
Yeah. So, and that I am definitely not a marketing person, but I think I brought up Black Lives Matter as a brand, I mean, genius, right? And again, bringing back to the sort of social media aspect too, we as hard as it was to watch, there was no sort of denying sort of the events that happened that sort of prompted the whole Black Lives Matter initiative. And so that sort of spread of information that quickly and the immediate sort of brand, and then moving from the media agenda to the public agenda to the policy agenda was just very, very thoughtful, I think, and very important, and hopefully keeps it on that agenda, because that's the thing, things fall on and off people's agenda, the political agenda. I mean, as we've all seen, I mean, every day we had a COVID update. Now, we get COVID updates and we get vaccine updates, but there's other things sort of entering the political agenda, and so things kind of can leave and come back. But, it is sort of important for that brand or sort of that issue identification to sort of have something that brings it all together, so that, you know, coalitions can sort of come around it, people can come around it, and it sort of maintains presence, I think, on all of the various agendas to sort of stay live.
Perfect. Sarah, thank you so much. Are there any closing comments or thoughts that you'd like to leave this group with?
Just, you know, get out and be active in the policy process. I know each of you on this call is probably passionate about something, and I think finding any way that you can engage in the policy process, whether it's, you know, being an academic and doing research on it, all the way to being an advocate, passionate about an issue. I really encourage, your voice is heard and so important, and that would be sort of my closing remark. Thank you all for participating.
Well, thank you for spending this time with us. You know, we call this open classroom, and it really did feel like a classroom today with lots of wonderful participation from our audience. So I thank them for leaning into the conversation and asking what they wanted to know. Jen Rose, as a first-time co-host, you did such a wonderful job. Thank you so much. And everybody, please stay healthy and safe out there. We look forward to seeing you at a different program very soon. Goodbye now.
Thanks, everybody.